Hello, my name is Jason, and today we'll be diagnosing my friend Conrad. Conrad plays badminton and has reported difficulties in using his full smash after repeated use. We will need to conduct a series of tests in order to properly diagnose what is wrong with his shoulder. Starting off with the range of motion tests, there are 6 tests we can do to target the point in which the shoulder hurts the most, as well as to eliminate some of the other diagnoses. For flexion and extension, instruct the patient to raise their arm straight in front of them, reaching overhead as far as possible. Then ask the patient to move their arm backward as far as possible while keeping it straight. The normal range for each should be 0 to 180 and 0 to 60. For abduction and adduction, direct the patient to lift their arm sideways away from the body up to ear level. Normal range for this should be 0 to 180. For adduction, have the patient bring their arm across the front of their body. The normal range for this should be 0 to 50. For external and internal rotation, with the elbow bent at 90 degrees, ask the patient to rotate their arm outward and inward, reaching about 70 and 90 degrees respectively. So a brief summary conducting these ROM tests. Conrad seems to have a good range of motion in both of his shoulders, yet he has some limitations with his right shoulder, but not enough yet to raise diagnosable suspicion. Continuing on with these strength tests, they have the same exact names. For shoulder flexion strength, the patient raises their arm forward against resistance applied by the examiner. For shoulder extension strength, the patient pushes their arm backward against resistance. For internal rotation strength, instruct the patient to bend their elbow at 90 degrees. The patient rotates their arm inward against resistance. The opposite is true for external rotation strength. Abduction strength, the patient lifts their arm to the side against resistance. For shoulder adduction strength, the patient brings their arm outward towards the body against resistance. So another brief reflection. Conrad seems to be straining his right shoulder more when we conduct these tests. This is a telltale sign for tendinitis. The following special tests can identify tendinitis within the shoulder. For the empty can test, the patient holds their arm at 90 degrees abduction with a slight forward angle and thumbs down. The examiner then applies downward pressure. In the Hawkins-Kennedy test, with the arm flexed at 90 degrees and the elbow bent, the examiner internally rotates the shoulder. So in conclusion, by performing these ROM, strength, and special tests systematically, you can thoroughly evaluate the shoulder for dysfunction and pathology. Thank you for watching.